Piroxicam is a medication that is used to help reduce pain, swelling, and joint stiffness caused by arthritis. By reducing these symptoms, it can help you to carry out your normal daily activities more easily. Piroxicam is a type of medication known as a nonsteroidal anti-inflammatory drug, NSAID, which works by blocking certain natural substances in the body that cause inflammation. If you are dealing with a chronic condition like arthritis, it's important to talk to your doctor about other non-drug treatments or additional medications that can help manage your pain. It's important to follow your doctor's advice and to read the warning section for more information. Before you start using Piroxicam, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with a full glass of water. It's important to take it with food, milk, or an antacid to prevent stomach upset. Remember not to lie down for at least 10 minutes after taking this drug. The dosage of Piroxicam is based on your medical condition and response to treatment. To minimize the risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose, take it more often, or take it for a longer time than prescribed. If you are taking this drug as needed, it's best to use it as soon as you feel the first signs of pain. Waiting until the pain has worsened may affect how well the medication works. It may take several weeks of taking this drug regularly until you get the full benefit, so be patient. And remember to tell your doctor if your condition does not improve or if it worsens. If you experience upset stomach, nausea, dizziness, drowsiness, or headache, be sure to tell your doctor or pharmacist. This medication may raise your blood pressure, so it's important to check it regularly and inform your doctor if the results are high. Some serious side effects to watch out for include easy bruising/bleeding, difficult/painful swallowing, hearing changes, mental/mood changes, signs of kidney problems, unexplained stiff neck, vision changes, symptoms of heart failure, and symptoms of liver damage. If you notice any of these, contact your doctor right away. While serious allergic reactions are rare, seek medical help immediately if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Piroxicam, a nonsteroidal anti-inflammatory drug, may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. It can also cause serious bleeding from the stomach or intestines, especially in older adults. If you experience stomach pain, black stools, or unusual sweating, seek medical help immediately. It's important to talk to your doctor or pharmacist about the benefits and risks of taking Piroxicam. Always follow their recommendations for the best time to take this medication and the appropriate dosage for your condition. Before taking Piroxicam, make sure to let your doctor or pharmacist know if you have any allergies to this medication or other NSAIDs. Also, be sure to discuss your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems. It's important to stay hydrated while taking Piroxicam to prevent kidney problems. If you experience dizziness or drowsiness while taking this medication, avoid driving or using machinery. Limit your alcohol and tobacco use, as they can increase the risk of stomach bleeding. This medication can also make you more sensitive to the sun, so be sure to use sunscreen and wear protective clothing when outdoors. If you are pregnant or plan to become pregnant, talk to your doctor about the risks and benefits of using Piroxicam. It is not recommended for use after 20 weeks of pregnancy. And if you are breastfeeding, consult your doctor before using this medication. When taking Piroxicam, it's important to be aware of potential drug interactions. This medication may interact with certain other drugs, increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Piroxicam include ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, and diuretics. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers and fever reducers that may increase the risk of side effects when taken with Piroxicam. Additionally, taking Piroxicam with other drugs that may cause bleeding, such as antiplatelet drugs and blood thinners, may increase the risk of bleeding. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, it's important to continue taking it unless your doctor instructs you otherwise. Always consult your doctor or pharmacist for more details on potential drug interactions with Piroxicam. If someone has taken too much Piroxicam and has serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. Remember, do not share Piroxicam with others. Your doctor may also order lab or medical tests while you are taking this medication, such as blood pressure, complete blood count, or liver and kidney function tests, so make sure to keep all your medical and lab appointments. Additionally, making lifestyle changes such as weight loss if needed, or doing strengthening and conditioning exercises, may help to improve your flexibility and joint function. Be sure to consult your doctor for specific instructions on how to incorporate these changes into your daily routine. If you are taking Piroxicam on a regular schedule and you happen to miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, then it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. As always, it's best to consult with your healthcare provider for personalized advice on your medication schedule. Make sure to store Piroxicam at room temperature, away from light and moisture, and avoid storing it in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.